The Minister for Health and Social Care, Lawrie Hooper, is with us. With your mask on, this is the policy that the government are taking, aren't they, still, that you should be in unventilated with strangers or something, is it?
Yeah, broadly it's the same thing. If you're in an unventilated space or a poorly ventilated space, we're still advising people where possible, and I've been a bit under the weather the last couple of days, so I'm still doing regular testing with the lateral flows. Yeah. All those are coming up fine, but just for the abundance of caution, there's no harm in wearing a mask.
All right. Really, I suppose I'd like to just do this one as welcome to the job sort of thing. All those, again, like I was doing with Julie Edge last week, you're on the outside looking in, now you're there. Yeah. And how different is that picture? What do you see once you're inside this machine?
I don't think the picture from the inside is much different from the outside, actually. So we all know that the challenges health service has been facing over the years, that there's never been any secret about some of that. And really seeing it from the inside is just kind of reconfirming some of those suspicions and some of those worries and concerns and some of those discussions that have already been had publicly, I think. So on the flip side, though, I suppose we're in a different place now because of the Sir Jonathan Michael report, and we have now got Manx Care established. We're starting to make real progress to chip into those recommendations, which should, I think, over the course of the next couple of years, start turning the supertanker. We should be in a better position in a couple of years compared to where we were a few years ago, and that's kind of the really positive light at the end of this tunnel, I think, as we are starting to see things happen that maybe wouldn't have happened under the old structure. And so really it's about, let's just keep pushing, let's just keep trying, let's just keep driving forward and seeing if we can make things better.
And this supertanker having Manx Care in there, is that what we're talking about here? This is the thing that's going to make the difference?
In part, I think having that separation will help to make sure that you've not got politicians making judgments around what might be clinical matters, for example, or operational matters. Equally, it lets us as politicians focus a bit more on the strategy, and this is where I think we've been let down in the past, not just in health, but more broadly. You get politicians that get really subsumed in the detail, and we get too worried about this particular grant application, or that particular business, or this particular type of surgical procedure, and that's not really for us. I mean, I'm not a medical expert, but asking me to make those kind of decisions would be a bit daft. So really, the one big advantage that the new structure has is you're letting people who know what they're doing make those decisions. And you've got politicians then doing what we should be doing, which is driving the strategy, building the framework and saying this is the road, this is the direction of travel. Obviously now it's up to Manx Care to fill that in and tell us how we're going to do some of this stuff. But it is a real partnership arrangement, I think, and that's...
Because it looks to me, there's like bureaucracy, there's all these extra people involved, and cushioning you between them. You're still in charge in the day. With Tim will, for instance, you've got to answer the questions, but you're going to back me off more and more probably with things. You'll just say, go to Manx Care, and then we have to struggle.
I think when it's really about operations or service delivery, I think you have to speak to the people delivering the service. And I think there's an expectation, really, that from my side at least, Manx Care are publicly funded. They are a taxpayer-funded body. They hold their board meetings in public. They are actually supposed to be quite open and transparent, and so far, my experience with them is they are. They're quite happy to answer those questions and to talk to people. And really, it's about making sure that they are actually being held accountable. And I do that as my job as the Minister. My department does that through our assurance process, but also I think the media have a role to play here. It is it's a very effective mechanism, I think, having journalists sit there and ask those difficult questions. And sometimes it needs to be me answering them or my department answering them because it is a strategic or a policy issue. Sometimes, though, actually the issues and the challenges you're trying to dig into will be very much operational. There'll be decisions that Manx Care have made that have designed a particular service or have opted for a particular care pathway or whatever it is. And actually they then do need to be held accountable and challenged to some of those decisions. And like I say, some of that will be the department, some of it will be Tynwald, but also I think the press have a role too.
So basically you're saying that you'd like to see us asking questions, getting hold of people, and you think that will happen? Because I don't know yet. I mean, I'm still in the early days about this. Things like, not, I wouldn't say blocking, but it's just more bureaucracy to get through. Yeah. You've got a lot of people in there who are working with the press department, but I don't know. You tell me. If things go wrong, we come to you, do we?
I think so, yeah. Ultimately, it's I'm the one that's supposed to be responsible, so ultimately that's where the buck stops. Right. There's nothing wrong with that. But you're right, I think I have an expectation that as we start to develop this a bit further, Manx Care have been up and running for a short while, don't forget, but as we develop this further, they will be able to come and do some one-on-ones and interviews and conversations. I mean, I'm aware that they have done some interviews recently around things like midwifery, for example, so there will be that start to develop a bit more, and you'll be speaking to people more on the front end, I think, rather than politicians like me who...
And the budget and how it's spent is now sort of with them, isn't it? You haven't got that finger quite on the pulse anymore because they control it, or only with the overspends you'll probably hear about.
Not quite. So the way that the budget works is DHSC are voted the budget by Tynwald, and we mandate that down to Manx Care, because ultimately it's the department's budget and it's the department's funding. The way that we control that then is through the mandate. So we put in that mandate document, and that's going to get published pretty soon, the next version, and we put in there some of the key things we expect them to achieve using that money. So then it really goes into Manx Care's pot, and we say, right, we've given you the funding, we've told you what to go and do, go do it.
So how they spend it is down to them.
The exact detail of how it gets spent will absolutely be their call, because that's why they exist, is to make those independent decisions, so without us trying to point them all over the place in terms of the detail. But like I said, we're the ones that will design that road and say, this is what we need you to do. So for example, we need you to reduce waiting times. For example, you'll see that in the island plan, there's a reference to that, and we'll say, right, we need you to reduce some waiting times. How they do that will be on them. I can't tell them what the best way is to get people hip operations quicker. I'm not a medical expert. They know the people, they know the systems, they can deliver on that. But it's up to us to say, we need you to do it. And that's kind of how the budget works now with that mandate. We tell them what we need them to do, and they then go away and decide how to do it and make sure it gets done on time.
So a massive backlog, cancer patients particularly, we're hearing what's going on there. This will be an overspend, there, won't it? At the end of the day, but they'll need more resources to catch up, and they come to you for that then.
Yeah, that's exactly the case. So, I mean, Manx Care, I say, hold their budget meetings in public, so everyone's aware that they are risking an overspend at the end of the year, and inevitably, I'll have to come back to Tynwald at some point and ask for that funding. But longer term, you're right, we do have a backlog, and Manx Care have been asked by us in the department to put together what's called a recovery plan, which basically is, go away and tell us how you're going to sort out these waiting lists. Come to us and tell us what you need to do and how much money you need to do it. And then we can have those conversations about where that money might come from. So can some of it be done as part of the existing budget bids we've already put in? Can it be done by making savings through your cost improvement programme? Or do we need to go and ask for a specific part of money from Treasury or from Tynwald? All these questions need to be asked, obviously, but again, it'll be driven by Manx Care coming to us and saying, clinically, this is how we're going to clear our waiting lists. This is the best way of doing it. And then it's up to us in the department to challenge that, make sure that that is really the right thing to do, and then to support them going on to Treasury or Tynwald or the Council of Ministers or wherever it is to try and support them to get access to any funding they need or any other support.
In your past life, of the detailed backbencher, are you going to be the detailed minister then, who will want to see exactly what is going on?
Yeah, that's a fair comment, and I absolutely think that's necessary here, because this role, it isn't really one of delivery anymore. This role is one of assurance and audit, and that is my background as my professional qualifications. I'm an auditor, and so really the department that I'm in now is a very different department to what it was a year ago. A year ago they were more focused on actually delivering the service, whereas now we're much more focused on that accountability, that governance and that assurance process, making sure that Manx Care are delivering the service that we expect them to deliver, and not just us but also that the public, I think, expect them to deliver as well.
Okay, well, finally, our island plan is out. You just made reference to it. So what can you give us the highlights on your department? What are you committing yourself to?
So the key things in there for us, you've got delivery of the transformation programme. Obviously that is fundamental, I think, to how we're going to take the health service forward over the next few years. There's commitments in there for things like developing the single care record, nursing residential care funding models, reducing waiting times is in there quite strictly as well. We've got some really big ambitions there. Obviously it's a 5-year ambition, it's a 5-year plan. We're not going to be getting there overnight. Really all of these things are quite key. The actions we're going to be seeing this year will be work around things like respite care. I'd like to think things around a mental health recovery college, I think, is being mentioned. There's all sorts of quite interesting and quite exciting plans coming out from Manx Care and from us as a department. The next step for us will be to obviously hopefully get this plan approved by Tynwald, and then we will be out as a department engaging with the public and with members of Tynwald around our strategic intent document, and that is really the document that sits underneath the plan that goes into a lot more detail about how are we going to do some of this stuff.
How much of this is you in here? I mean, when you sit around that table, you fighting your corner as the minister? Or?
Yes, that's fair to say. I am absolutely fighting my corner, as I think all the ministers have been, not just on health matters, but education, enterprise, treasury, everything in there. I think it's fair to say is an amalgam of all the ministers, and actually a lot of feedback from Tynwald members as well and the public. I've done a number of public events. I was down at the one in the south, and I've just done one in Ramsey as well with the chief minister, with a lot of public input, I think, into that. We, as a Liberal Vannin Party, also held a public meeting of our own where people gave us feedback. A lot of that has been incorporated into the plan, so the version that's actually getting published now is quite substantially different and improved from what was originally drafted a couple of months back.
Finally, when you first got the keys to the door to a department, what was it like? I mean, walking in and seeing the insides of this thing and what's been going on. Were you surprised? Were you shocked? Were you pleasantly surprised? Or?
I don't know. I think it comes back to the first question you asked. Was I surprised to see what was in there? No, actually, I was quite aware, I think, of a lot of what was going on anyway. I think perhaps the full scale of the challenge, perhaps I hadn't fully appreciated. That's fair to say. Seeing some of the nuts and bolts. But no, it's a different job to what I was doing before as a backbencher. It's a lot more focused, and I think the responsibility kind of weighs on you a little bit sometimes when you're sitting there realising actually some of the decisions, rather than just offering input and suggestions as a backbencher and providing that kind of critical friend. Now really the buck does stop here, and sometimes you're making decisions that you think, oh, I really don't want to have to make that call, but ultimately somebody does.
5 years of this, you up for it?
Absolutely. I think, like I said at the start, when it might have been you or Sam that asked this question, how long am I going to last? The last Liberal and Health Minister lasted a year, so I've got 11 months to go. Is that right? So yeah,
countdown's on.
It is, but no, I'm absolutely committed to this. I mean, people have been asking me for quite a while now, the last couple of months, why did you take the job? And actually, all I've been able to provide them with is sort of a half joking answer, because I don't really understand the question. If someone said to you, Paul, do you want to help fix the health service? And give you the opportunity, of course you're going to say yes. Yeah, of course, throw me in at the deep end. So it's an odd question for someone to ask you, because if you're given the opportunity to try and mould and fix and shape something as big as our health service, why would you turn that opportunity down?